excited to be here and to talk about, how best to prepare for your new headache specialist visit, because there's a lot to do and this can be a little bit overwhelming. Really, the goal is to balance time between sharing all of the pertinent information about your headache history and spending time listening to the thoughts and recommendations of your headache specialist, as well as having time to ask questions you still have remaining. So it's a lot to get done in one kind of first visit. So it's important to be prepared before your visit so you can optimize your entire experience and really advocate for yourself. So there are things you can do before your visit to make sure your time is spent efficiently. And there are also things to do the day of your visit and during your visit. And I'll talk about, all of these things and just some recommendations and hopefully some tips that can be helpful. So when you're planning for your visit, one of the most important things is to really know your history so you can really best advocate for yourself. So I would recommend taking some time in the days before your visit to think about your headache history in general. So if your headache specialist has asked you to fill out forms beforehand, sometimes there's a questionnaire that's asked of you. That's actually a great way to help summarize a lot of your history and may help kind of jog your memory on things you may have forgotten about from years ago. And keep a copy of these forms for your own records as well. And weeks or even like months before your visit, consider starting a headache diary. And we do know that there aren't a lot of headache specialists out there, and it is a growing field, but it can take for some people several weeks or several months to get that first visit. So this is actually a good time for you to start a diary and start looking at what your headache patterns are like. And this is actually one of the most important things you can do, and really the only objective measure we have to evaluate if your headaches are improving, if they're staying the same, or if they're worsening. And there are so many options out there now for keeping a headache log. It can be done through several smartphone apps that are out there and now available specifically for the purpose of logging headache days. Or if you prefer, you can just write it down in your own calendar, paper and pen. And a headache diary doesn't really have to be super complicated. What's really important, and for me, for my patients, what I find most important is just knowing on any given day, did you have a headache, and possibly measuring that intensity. And you can document that either on a number scale if you like 0 to 10, or even just as saying it's mild, moderate, or severe. And keep note of even the more mild headache days you have. Also write down which days you took what's called an acute, abortive, or rescue medication. So these can be anything from like over-the-counter medications or prescription medications like triptans. So we want to know the days you're having headaches and what you're taking for them. And your doctor will likely also ask you to describe many characteristics about your headaches, including if you have associated features like nausea, vomiting, light or sound sensitivity, dizziness. So these are things to think about. You may also get asked when you first start having headaches, so of any kind. So if this has been going on since childhood, or if you remember any kind of precipitating events or a time where headaches got worse for you or got better for you. So understanding your timeline is really helpful for us. And they may also ask about a family history of any type of headache. So you may want to gather some of that history from your own family members as well. And another very important question you'll get asked is about your medications. So both your current medications and past medications. Anything you've taken for when you get a headache, and also if you've been prescribed anything to help prevent headaches. So it's important to know the names and the dosing of your current headache and preventive medications and how long you've been on them. And also for your acute or abortive medications, it's important to know which ones you use, what dose, and how often. also important to know if you combine any medications. So for instance, if you're combining like a prescription triptan with something over the counter like Aleve or Advil or Excedrin. And in addition, what medications you have tried in the past will be very important to know, because this will help your doctor in guiding them and deciding what other options to try for your treatment. So treatment is going to be really individualized. So it's so important to know what you've tried in the past, what's worked for you, what hasn't worked for you, what's given you side effects, or what you didn't tolerate well. And so just like your current medications, it's going to be important to know what doses of past medications you were on, for how long you were on them, and why you stopped them. Was it because they were not effective, or was it because you couldn't tolerate them? So there are many medications that are used for other diagnoses that also overlap as preventive medication treatments for headaches like migraine. So for instance, we oftentimes use anti-seizure medications or high blood pressure medications or antidepressant medications to prevent headaches as well. So if you have taken any of those at all in the past, even if they weren't for headaches, it's also important to note them as well, just to know if you had any problems with them or if they happen to help your headaches at that time too. And there are now, many injectable therapies available for treatment. So it's good to know if you've been on any in the past and for how long. And it can, be hard to remember what medications you've been on in the past. So you might want to consider looking through your past medical records if you have them, or even going through your prescription records from your pharmacy, because that can be a good resource to see all the things you've been prescribed in the past. And another important piece of information to think about before you go to your visit is what your goals are from the visit. It could be as simple as, I just want to get a diagnosis, or I want to get a second opinion, or, I want to talk about new medications or ask about even non-medication treatment options, or, a combination of things. And it could be all of those things. So think about that beforehand, try to formulate any questions you might have beforehand, because you're going to have a lot of time where, you and your doctor are speaking and they're giving you a lot of information. So they may very well have answered a lot of your questions, but maybe they didn't answer all of them. So it's good to have those so you can ask at the end of your visit. So now let's talk a little bit about how to prepare on the day of your visit. Things have certainly changed since the pandemic, and there are two possibilities for the modality of your visit, either telehealth or in person. Both have their challenges and advantages, so I'll talk about some important steps to prepare for each. So let's first talk about the virtual visit. Every clinic or hospital platform for these visits is a little bit different. So you want to make sure you give yourself plenty of time to get familiarized with that platform, and just so you can be ready on the day of your visit. So a lot of them may ask you to log on through a smartphone application. Make sure you have this downloaded on your phone beforehand, just to make sure there aren't any glitches and that you're able to log on with your username and password. And if you're logging on through a computer and a web browser, also try and check to make sure your web browser is up to date, as some older versions may not actually be compatible or support the platform that you need to log on. And many offices will actually require that you check in advance. And checking into a visit can actually take a lot of time for people who have done these virtual visits. They can take 15, even 20 or 30 minutes. So try to make sure you're doing this well in advance of your visit, so you don't feel rushed answering any questions beforehand. And also that your browser or your app is working fine. There may also be a questionnaire to fill out, as I had mentioned before, and then oftentimes that's done through either the web browser or the app too. And these questionnaires can oftentimes be long, because they can be asking a lot of questions about your medical history and your medications and your headache history. So make sure you've taken time. You can sit down like the day before your visit to fill all of this out. And another important factor to consider when you're doing a virtual visit is the internet connection. So this isn't always something we can control. Try to make sure you're in a place where you know your connection will be the most stable. Or if you know there's a room in the house where the internet connection tends to be the best, try to set up your device in that room. And also try to find a quiet place where you have privacy, so you feel most comfortable during your visit. If you're somewhere where maybe there's a lot of background noise or there's other people around, you may want to also use headphones, because you can that way at least block out some of that noise. One thing to actually avoid during a virtual visit is driving or being in a moving car, even if you're a passenger in the car. So we want you to be safe, and we certainly don't want you driving during a visit. So it's certainly okay to reschedule a visit if something came up and you're not able to be in an optimized place for the visit. And being in a moving car, even if you're not driving, is oftentimes not only distracting for you, but your physician, and the internet connection isn't always the most stable if you're moving. And also just check to make sure your phone or your computer are fully charged, because we know video visits can take up a lot of battery power. Another important thing is, just to try to be as early as possible. And many of these platforms actually allow you to log on at least 15 minutes in advance of your appointment. So plan to be ready and situated 15 minutes before, so you can also, take care of any last minute technology glitches. And if you're not able to log on, there should also be like a phone number for IT support where you can reach somebody, or a clinic phone number to call. So, we want you to optimize your time with your physician. So trying to get all of this done before the visit actually starts is ideal. A great advantage of a virtual visit is that you don't have to leave your house, figure out directions or transportation, and it doesn't take up like a large chunk of your day, especially if you live far away from the clinic or hospital. And now I just want to talk a little bit about in-person visits. Although there aren't the technical difficulties that come with a virtual visit, a huge limitation can be unpredictable traffic, especially if you live far away. And also this can come with stress and anxiety and cause worrying about just getting to your visit on time. So even like personally, I'll make it a goal to arrive to my visits 15 to 30 minutes early, because you never know where parking can be. This can always be far or hard to find. So you certainly want to plan for that. And then there may be a line just to even check into your visit. And then it'll take time to get your vitals done. So we want you to get there early, so none of that takes away from your time with your physician. It's also just always better to be early than late, as many clinics and hospitals actually have late policies. So if you've arrived after that grace period, you could be asked to reschedule your visit, and we don't want you to have to do that. And coming early to your visit is also a good time to hand over any, let's say you've had imaging done elsewhere and it's on a CD, you can hand that over to the front desk so they can start uploading it, and you can pick it up after your visit's over. And then if you are coming into your visit, make sure you've brought with you any of your notes that you want to share, or if you have a headache diary or medication list, so you have those prepared when you're talking to your provider. And whether your visit is virtual or in person, always the most important thing is to really advocate for yourself. You'll certainly have time to ask questions and get any clarification on things you aren't quite sure about. And another important part is, after your visit's over, you'll likely get a copy of your patient instructions in your after visit summary. So either this is going to be printed for you if you had an inpatient visit, or generally found through the app where you logged into your visit. Review these, because this is going to be probably a lot of notes for you. It's going to have a lot of information, and it's really going to be probably challenging to try to remember everything from your visit. So in summary, I want to review just the kind of 5 most important things to do to prepare for your new headache specialist visit. Number 1 is try to get to know your own history really well, so you can best advocate for yourself. Number 2, get to know your medications, both current and past. Number 3, establish the goals you want from your visit so you can communicate those to your doctor. Number 4, fill out any pre-visit paperwork or questionnaires. And 5, on the day of your visit, be early and prepared. So for a virtual visit, find yourself a quiet, private place to set up and make sure your internet connection is stable. And for in-person visits, bring any imaging or diaries or medication lists you have, and keep in mind, traffic can be unpredictable. So try to get there, safely and early.
Thank you so much, Dr. Hindiyeh, for that. That was really awesome. I especially love the fact that you're so patient-centric, which some doctors are not, but increasingly we're starting to see that. So I love that you're reminding people that we need to know our own history and our own meds, and we need to advocate for ourselves, right?
It's so important. I think it's the most important thing. You will have a very successful visit if you're able to, one, understand your own history and communicate that well to your physician.
Right, absolutely, and that makes total sense. I think the days when we didn't advocate for ourselves, we weren't expected to know anything, would show up for a 10-minute appointment and then leave feeling dissatisfied. Those days hopefully are starting to become a thing of the past as we start to take responsibility for our own health and partner with our doctors.
I agree.
Yeah, and that's why I love doing these Facebook Lives, because I think that it puts a real face on doctors such as yourself who want to reach out to patients. I know that I am often very intimidated when I go in to see my doctors. Most people who know me would find that hard to believe, but I become a different person as soon as I walk through that door and see someone wearing a white coat. It's very intimidating for me, and I know that I'm not alone in that, so I have to be really prepared.
You're certainly not alone. I feel the same way too.
Well,
But
that's
just
good to know.
Your provider has your best interests as well. So we're all there for the same goal, and that's to make sure you're satisfied and you get your goals met.
Right. And I'm sure that as frustrating as it is for us that the time we have is so short, it's got to be frustrating for doctors as well.
Of course, I would love to spend hours with each individual, but we don't have that. We have a lot of time constraints, and so knowing your own history and being efficient with it is so helpful. So we can spend time on unanswered questions and other things as well.
Right, absolutely. That makes total sense. So I do have some questions for you from other people. And the first one is, especially on the first visit, what would I expect in terms of diagnosis, imaging? What is a reasonable expectation, and how much time would normally be spent on that first visit, getting that history?
That's a wonderful question. And time-wise, it all depends on, what institution or what facility you're going to. Those visits can be anywhere from 30 minutes to an hour, depending. So for instance, in a private practice, you'll likely just be seeing one provider, so it may be a little bit on the shorter side. But in an academic institution, you have to keep in mind there are many trainees there. So you're very likely to see a medical student, a resident, or a headache fellow as well. So they may be getting a lot of the gathering the history and then talking to the attending physician and coming back. So this may take a little bit more time, but all of this is crucial in getting you the right diagnosis. So, depending on if you already have a diagnosis in the past and what it is, certainly your headache specialist can help with either reaffirming a diagnosis or giving you a diagnosis. But sometimes, if it's for primary headaches, like migraine, like tension type headache, like cluster headache, yes, you'll probably get a diagnosis during that visit. And then oftentimes that can be something like chronic migraine as well. But if your doctor's not sure, or there are other components that make them think of a secondary headache, like maybe this is something else going on, then that's when you may not get a diagnosis right away. You may be told, okay, well, this looks somewhat like migraine, but there are other things I want to think about. Keep in mind, migraine is a clinical diagnosis, actually doesn't require, and you should not be imaging. So getting, labs and imaging shouldn't be done for migraine. But if there's suspicion of something else, that's when, if needed, imaging can be done.
Right, that's really helpful to know. I know that we also see a lot of comments in our groups about, especially when new people come in, I'm trying to find the reason for this. I'm trying to find the cure for it. And so I think that people go into a doctor's appointment with that expectation.
Yeah, I think that's one of the most challenging things, for us, because unfortunately for most headaches, there's no cure. Headaches, especially, migraine and most of these primary headaches are quite genetic. Whether or not people in your family have them, your genetic makeup makes you susceptible to having them. And that's not something we can change. So it's a matter of management of headaches throughout your life and doing what you can to help prevent them, as opposed to finding something to take away or a way to cure them.
Right. And I think it's very important to walk in with that perspective, that understanding. Otherwise, you walk out frustrated and, wondering what's wrong with you or what's wrong with your doctor, what's wrong with the healthcare system. And it's kind of a lose-lose situation. So
I agree.
Now, many of us have very complex histories and we move around a lot as well. So we may have like this huge folder of medical records, which is probably helpful for the doctor, but realistically, who has time to go through it? So my question for you is, how much does the doctor really need when you first start out with them, for example? What is most helpful for them to have? How much of that information really is worthwhile?
That is a great question, because so many times you'll get piles, 50, 100 pages, and
that would be me.
most of it isn't actually relevant. So the most relevant information is, I want to know about you, what your headaches are like now, what they've been like in the last few months, in the last year. How has this changed over time for you? And getting that history is actually the most important. And sure, if there was concern for other types of headaches, had imaging been done, had labs been done? Generally, yes, and generally they're all normal. So I don't necessarily need to see a copy of all of that stuff. But what's going to be most pertinent, I think, is understanding the treatments you have tried and the treatments you are on, because that can help us navigate what the next steps in your treatment path can be.
Right. And also, obviously, with insurance, a lot of the time you're required to do step therapy. And so if it's not in the records, right, that you've tried something, you may be asked to try it again, right?
Yes. And insurance is just getting harder and harder and harder for us. It, especially during the pandemic, has not been easy to get therapies covered. So it's really important to be able to document what you have tried. And, now they're making us document the names, the doses, the duration of all of those things as well. So it's important to know all of these before coming to your visit.
Right. Is it helpful to have a cheat sheet? So for example, I have like a 2-page cheat sheet. 1 page has all the medications I've ever tried, how long I tried them, right, the doses, and whether they worked, didn't work, whether I had side effects, and then other conditions I have, which speaks to contraindications, so that there's just a real easy referral sheet. Is that a good idea?
Absolutely. It's not only helpful for us, but it's helpful for you, because even for myself, I can't remember what medications I've been on and what doses I've tried for various things. It's a lot to remember. So having a cheat sheet and, a page, 2 pages is more than enough, because you can get everything on there concisely, and it can be really helpful for your specialist too.
Right. And I'm sure that's especially true as we have all these new medications coming out. I always think I'm going to remember something and I don't. So it's important to have that documented down, just for sure. Now, I had the privilege actually of seeing Dr. Cowan when he was practicing in Ojai. And so I was introduced to Bon Triage. And I'm wondering if you, how much of, I shouldn't ask you that because obviously, you know, you work with him, but is that a helpful tool for you in your practice of a new patient? I know that I've used it sometimes with new doctors and with disability claims as well, because it gives you a great summary.
Yeah, so Bon Triage, there's two kind of avenues of it. So there's one that you kind of input all your information and it gives you like a written out paragraph form of your headache history. And that's great. So however it's done, whether it's through Bon Triage or even just you jotting notes down and relaying it to your provider, it's wonderful.
Right.
I feel like either way, you know, your doctor is going to ask you the questions too, because they want to hear it directly from you, because there may be things that you may have forgotten to mention, or you want to add on that maybe you weren't able to add on when typing it all in. So I think it's great to do both.
Right, that makes a lot of sense. And for those people who do want to try out the Bon Triage, it's bontriage.com. And I'm sure someone's going to put that in the comments for people who are interested in just checking that out. Let's kind of switch over to like tracking apps, because there are a number of different tracking apps now so that we can follow up on our headache attacks. And they provide a lot of information. And sometimes I feel that like I'll go into my doctor and he'll ask me questions I didn't track, like how many of which type of medications I took specifically. Most of these apps are not very good at tracking that. But they'll provide information, you know, you as doctors don't want. So what's most important?
And I think this is where it becomes challenging with some of the apps, and like it can be frustrating, right? Because if you're in the middle of a migraine attack, the last thing you want to do is be staring at your phone, that screen, and logging all of these things. Really, the most important thing is just, you know, did you have a headache that day, and what medication you took? You know, for us, tracking those medications not only helps us understand, one, if they were helpful for you, but two, are you underusing them? Are you overusing them? And is this also contributing to more headaches? So those are really the most important things, I think.
Right, that makes total sense. So I definitely appreciate that. Again, I think it's one of those things that we can have so much information at our fingertips, but it's not all helpful. And sometimes the most helpful information is that which is not in these apps or at our fingertips necessarily. And so it's important to know that. Now, when we're actually at the visit and we're getting ready to leave, what is most important for us to have in writing? So for example, I'm thinking, you know, what to do if our abortive medications don't work. You know, what is really important for us to have in our hands when we walk out the door?
Yes. So you should certainly have your action plan, and that can be, you know, generally if it's an in-clinic visit, as I mentioned, you'll probably get a printout of your after visit summary and it should be in there, or, you know, via an app as well. So, you know, especially these things like what to do when you get an attack, right? What are the steps you're taking? Which medications do I do first? Then if that's not working, what do I take? Then what is my plan if that doesn't work? Am I calling the clinic? Am I going in to do this? What are my steps? That steps in that action plan for an acute headache, but also, you know, those steps and ways to help prevent headache should be in that plan as well. And not all headache specialists are going to be prescribing medications. So depending on the practice, some are consultative services only, and others do prescribe. So as you guys probably know, there's just not enough of us out there to be able to, you know, follow patients very regularly. So, you know, in that action plan, though, maybe the names of recommended next step therapies to try, and that the dosing of those medications, and even, you know, here's plan A or plan B or plan C. So you should be going home with a copy of all of that.
Right, that makes a lot of sense. I know that we get a lot of questions from patients in our groups who say, I took such and such a medication, I still have my migraine. Is it too soon to take the next medication or to take a second dose? And so it's really important, not only, like you say, to know the steps you take in terms of medications, but the timing of them as well, right?
Absolutely. And, you know, for certain medications, it should also be when at your pharmacy, when you pick up the medication, it should be on the bottle as well. So for instance, like for sumatriptan, take it at the onset of your headache. And then if your headache is still there after 2 hours, you can take it again. So these are really important things to know, so you can optimize your own treatment as well.
Right. And that's really important, because when we get questions, obviously we can't answer that. In our groups, we're not doctors. We can't give medical advice. None of us should be giving medical advice to each other. Only your doctor should. So it's really important to get that information from your doctor. It can, many times often help prevent people having to go to the emergency room, because they understand what to do and when to do it.
Exactly.
So that's super important. Just a slightly different question. A lot of us have comorbidities. Obviously, that's just kind of part of the fun stuff of living with migraine. And there's this kind of sense that we see one doctor for migraine, another doctor for autoimmune, another doctor for asthma, and all the comorbidities we have. And that a lot of times they don't communicate with each other. And so we'll sit in front of our headache doctor and ask, is it safe for me to take this medication? Or maybe we won't ask, so what is the best way to communicate all the other things we have going on?
Yeah, that's a wonderful question. So again, you have to be your own advocate. If you know your comorbidities and your medications for other things are going to play a role or may play a role, definitely speak up about it, because we need to know. We can see your chart, but we only see a limited amount. So if you're coming in brand new to a new city and you don't have those medical records, we won't know unless you tell us. But I find it really important to make sure we understand the comorbidities, so we can also tailor treatment to that. So there are medications obviously that are contraindicated with other diagnoses, or there are ones that can help both.
Right.
So anxiety and depression, a lot of our medications overlap. So it's really important to know. And even there are medications that can help for people who have insomnia and migraine. So there are some really important things to understand there.
Right, absolutely. And you just made a really important point a couple of minutes ago about there not being enough headache specialists. So our organization actually has a headache specialist directory, which includes all the UCNS board certified doctors and all the AQH certified doctors as well. And so I just updated it yesterday. It's not on our website yet, but for those of you who are interested, it will be up soon. And I discovered there's only like 697 UCNS board certified doctors who are still practicing in America. And there are less than 200 additional AQH certified doctors. Some have both. So that's less than 1,000, which is very sad.
Yeah, we need more.
We definitely need more. But that does kind of bring up a challenge. So a lot of the time when people go to, for example, a neurologist, especially if they're new to migraine, they don't understand that there is a difference between a general neurologist and the education that they've received for headache disorders and a board certified headache specialist. So could you just take a minute and explain a little bit about that difference?
Yeah, absolutely. So, to be a headache specialist, you don't necessarily have to be a neurologist, right? There are some headache specialists who have done primary care first, or other specialties first. But neurology is a residency that's a 4-year residency that we do, and only we get like little bits of headache medicine in that, depending on where you did your residency. But a general neurologist will tackle everything in neurology, from stroke to epilepsy to movement disorders, and as well as headache. And headache is one of the most common, disorders that they're going to see. But a headache specialist has then done, after their neurology residency or primary care residency, 1 to 2 years of a subspecialty training in headache medicine. So it is a lot more detailed. You see only headache patients during that time. So you certainly do gain a wealth of knowledge into headache medicine. And then we take a specialty exam, which is the UCNS exam that you mentioned, to be board certified in headache medicine.
Right. And there's a certain amount of ongoing education required as well, right?
Oh, yes. I just took my recertification exam for a headache just a couple days ago, and
Oh, so
there
you know
are
it well then.
yes, and there are conferences throughout the year, both virtually and starting up again in person, that actually a lot of neurologists in general will actually attend, because it's so important, and the topic of headache and headache treatment is so important that I think a lot more general neurologists are learning more and more about how to treat as well.
Right, absolutely. And that's really important. So I only have two more questions for you. I know that we're getting short on time. This has been a really amazing time with you. So the first question is, bearing in mind all that information about the difference in education, at what point in time might it be appropriate for someone to see a certified headache specialist as opposed to a general neurologist?
That's a wonderful question. Sometimes not so easy to answer, right?
Right.
It depends on how comfortable your general neurologist is with headache. Some are very comfortable. Some are comfortable with prescribing medications, injectable therapies. Some are skilled in Botox and other injections as well. So yes, if you have a headache specialist or a neurologist like that, you don't need to see a headache specialist. But if your general neurologist isn't isn't as educated, or maybe just doesn't know exactly what to do next, that's when the time is to see a headache specialist.
Right.
And if they've tried 2 or 3 preventive therapies for several months at a time, and things still aren't improving for you, then again, that's a good time to see a headache specialist.
Right, that's really helpful. Also, I know in my experience that some neurologists are not comfortable prescribing certain medications, certain rescue medications like ketorolac. And so that's often, just a sign that you need to kind of be bumped up the ladder, as it were, to someone who has a little bit more experience in it. So that's definitely really helpful. I also know that, sometimes it's just most important to have a doctor who partners with you. So there are times there's no way that we have access to certified headache specialists all the time. There aren't enough of you, and we don't have any near us a lot of the time. But if we have a doctor who is willing to work with us and partner with us, and and we're willing to advocate for ourselves, then that makes the difference.
And I think this is where that virtual consultation with a headache specialist comes in so well, because even if you have the one visit with a headache specialist, you get all of these recommendations. That list of recommendations will go to you and your neurologist. So then your neurologist now has a new set of tools to help you and guide you in that process.
Right, absolutely. So this is the last question. It just kind of popped up right now. So you mentioned that sometimes when we see a doctor, it's for consultation only. Sometimes they're able to prescribe, and that situation has become even more complex with the rise of telehealth and the pandemic. Mm-hmm. So the question is there a way to know before the visit what type of visit that is? I mean, presumably there has to be, but how can we ensure that we understand? That's
a really great question. And sometimes it's going to be very challenging to understand. You might want to, sometimes in your pre-visit paperwork, it's listed there. This is a consultation service. We do not prescribe any medications. Or it may say, like, this is a consultative service, or it may not say at all. And that's when you need to kind of probably take it upon yourself, call the clinic and ask, do you prescribe prescriptions to everyone? Or, they may not, they may only prescribe very particular things, or maybe they only prescribe things that are, injection therapies. So, the best way though, and sometimes though the clinic staff may not know, it's one of those things to ask at the beginning of your visit too. So if you have a virtual visit, try to understand what their model is like, because that also is changing constantly, with new requirements from insurance companies and with telehealth. That will change, and there's times I don't know what we're even capable of being able to do at our own institution. So certainly have that on your list of questions to ask your specialist.
Right, absolutely. And I just want to let people know that some of you may be thinking, well, what's the point of the consultation only if I can't get prescriptions that I need? But often we need a second opinion. We need a second pair of eyes. on us. I actually see a headache specialist in New York, even though I live in California. And until there was licensing in California for them, it was a consultation, and he would work with the current doctor I was seeing. And so there is a lot of value in that, but you need to know ahead of time, like you say, what to expect, what can be done, and then follow up afterwards. So can't emphasize enough the need to advocate for yourself, be responsible. And we didn't even talk about when prescriptions are prescribed, that often there are insurance roadblocks. And so we can follow up on that too, right?
Yes, absolutely. Yeah. You might become best friends with your insurance company because you're trying to get an approval through for a new medication.
Right, absolutely. I think my insurance company always says, oh, it's that British woman coming, just give her what she wants, because I'm a very squeaky wheel, as most people who know me know. But that's okay. My doctor's office loves me because I participate in that. It makes their life easier, so it's important.
Absolutely.
All right, we're going to bring this to a close today. Thank you so much for being with us, Dr. Hindiyeh. Thank you, everyone who has joined us today and everyone who watches this afterwards. I hope that you found it helpful. If you have any comments or questions that have not been answered in this live event, please let us know in the comments and let us know your best tips for preparing for a doctor's visit. We want to hear from you. We want to know what works, what does not work. And again, thank you for joining us.
Thank you so much for having me.